Definitely. I said up to the age of 65. Pap smears should start as early as at the age of 21. If you are entering menopause is a transient period in a woman where her reproductive functions are coming down, her hormonal changes are shutting down, and the god is changing. A woman, your reproductive life is over. Now you are going to live a normal, healthy life. So, what is the transition area? So, during that time, not only pap smear, but I always recommend a woman has to have a general body checkup. She has to have a mammography also, because a breast cancer is also rise in our country. She should have a routine sonography, and she should have what we can say a cardiac checkup also, because we have seen, because there is a low estrogen in the body, so these are the risk factor for heart disease. So you have to look into that. And menopause will increase your weight also, so it is better to take care of your cholesterol, your bone health also. During reproductive age, what is happening? Women is menstruating, women is having kids, so calcium is going down, so that also gets less, and that also be so in menopause time, a woman has to have a total checkup and look into all this area, because now the life expectancy of women has increased. Before we had expectancy up to for 50 years, 55, 60. Now women are living 75, 80. So 35 years after menopause, so you should have a healthy life. So many areas you have to look into it when you are menopause, not only pap smear, but the whole body checkup. See the symptom. When the virus enters your body, there is no symptoms. The virus slowly replicates and slowly it turns into cancer, which takes 10 to 15 years. And once the cancer develops, what is cancer? It is abnormal growth of the cervix. So cervix starts becoming like a erosion. It starts bleeding. So there is a touch contact. When they have sexual activity, there is bleeding. There is a vaginal infection, they will she'll keep on having rejection, because the cancer is growing inside the cervix. And then she will have discharge, she will have menstrual heavy periods. These are all signs of early cervical cancer. And in our country, what is happening? The cervical cancer, the cervix, this is the cervix, the whole cervix, the cancer has spread, and the cancer is coming out from the cervix and going to the side areas. Side areas are the areas where there are nerves, which are goes in the legs. And thus आगे जो होता है, जो on the front there is a bladder, and in the behind we have a rectum where the stool passes. So the cancer spreads from here and goes to the surrounding area, and they cause pain, they will cause bleeding, they will cause urinary infection, and in that stage women are coming to us. So these are the very dreadful symptoms of cervical cancer, when the pain starts, when you have urinary infection, when you have what you can say problem in your stool and everything. That is stage 4, and that is the place when women are coming in India, in our country. Not only in the rural, but even in the metro cities, women are coming. They just sit at home. This is normal. They say it's menopause. These infections are going to occur. This is normal thing. And they have been told also, कि ये तो menopause, so these are normal, you should ignore it. And they come with the last stage cancers. No, it's not at all hereditary. It is caused by an HPV virus, which spread from one person to one person, but it is not hereditary. No, the cervical cancer is not today. It's not a today's disease. It is since many years. I think so. The Wertheim hysterectomy, which was being done for cervical cancer, it came in 1900. So it's a very old disease. That time we did not had records and everything, but the cervical cancer was there. Pap smear was invented in 1943. You can imagine, 1950. HPV came in 1980. So it's a very old, 100 years old disease, and it was reported, I think so, in early 800 or something. But the statistics have come very much recently in last 50-60 years, the cervical cancer, because we all had the records. And in the Western country, because of very good screening method, the cervical cancer has dropped there. If you see, Australia is in the verge of cervical cancer elimination, because it is doing screening and vaccination since last 15-20 years. In India, the what we can say, the figure has remained static. Recently, we have seen a slight drop in cervical cancer incidence in India. We don't have a whole picture of each and every woman, because these all data are taken from the cancer registry, and we have 4 registries in the 4 zones of India, and from that the data are coming. Probably we may be having more also, because certain things are never reported only. Looking into this registry, they say there was a slight decline, 0.4% decline in the incidence of cervical cancer. Probably because in last, I think so, 5 years, there is sudden rise of cervical cancer talking going around. So there is increase in the screening also. And most of the metro cities now made a package of doing a pap smear routinely in the health checkup. So women are being picked up early and they have been treated. There is also a buzz of vaccination. So this has reduced the incidence to a little bit, but is a very marginal. We cannot be very happy about it. We really have to work it out to come into WHO vision. You may be knowing WHO has made a call for 2030 for elimination of cervical cancer from the world, and that is by doing 90% test screening, 70% testing, and 90% treatment. 90, 70, 90. Now, if you look into the India, 90% screening, you can, I told you 400 crore women. How we are going to achieve? What is our screening strategy at present? Hardly 7%. It was 0% to 1%, it has come to 7%, and we have a marginal difference. If you think about testing, screening, if you think about vaccination, so how much vaccination we are doing? 1%, 2%. So it is 90% vaccination, 70% screening, a huge number. So people like you, we can use this platform. We have to spread awareness. We just can't wait for the government to come with some strategies and such. I always say कि वो डंडा लेके पीछे पड़े and we do it. No, we have to come with ourselves and we have to save. We know this is a preventable cancer. Very few cancers are preventable, and this comes in a preventable cancer. So it becomes a moral duty of each and every woman. They should come forward, they should get tested and get your kids screened, vaccinated for prevention of all these dreadful diseases.